Good morning, viewers. Welcome to another episode of Monitor Your Health, the program where we educate the public on contemporary health conditions. Today, we're going to talk about autism. Autism is a condition that is growing worldwide. I think about 25 million people is said as 2015 to have suffered from autism. This number has increased from what it was in the 70s. There are a lot of conspiracy, there are a lot of controversies around autism. We have situations where, families will refuse to take vaccinations around certain conditions because of the concern as to whether this relates to the cause of autism. In order for us to throw more light at this, we are bringing onto the program a psychiatrist from the UK, Dr. Femi Ogunremi. Dr. Omokanye, you're welcome to the program.
Thank you, Dr. Femi Ogunremi, for having me today on this important topic. Hello, viewers. My name is Dr. Femi Ogunremi. I'm a psychiatrist with special interest in children's mental health from the UK.
Thank you so much for granting us your time to discuss this important topic. So let's just dabble into it. What is autism?
Yeah, autism is, by definition, is neurological condition and also at the same time a developmental condition. It is, in some quarters, it is believed not to be a disease, but are conditions that happen, unfortunately, in the womb when a child is still developing in the womb of his or her mother. It is associated, or it is, what constitutes neurodevelopmental, what constitutes autism is as a neurodevelopmental problem is that there are, let's put it in a very simple way. Human brain is responsible for most of human activities, especially the physical functioning, emotional, language, and speech development. So in autism, there are areas of the brain that are not properly developed or as a result of maybe injury or an insult. So this area of the brain is not properly developed or is not well developed. So in essence, a child that is born with autism struggles with language development. They also struggles with social interaction development, and their behaviors are characterized with repetitive, and constant interest in a restrictive manner that makes it really very difficult for them to function in a normal social interaction and setting. So simply, in a very simple way to understand, that's the definition of autism.
Okay. So, that must be a very challenging situation whereby we talk about, neurodevelopmental, abnormality. Can we even throw more light to that so that our audience can understand? When we talk about neurodevelopmental, malfunctioning, what do we mean?
Yeah, simply what it is when a child is, when a woman is pregnant and the brain, of course, as we know, is one of the most important organ of the body, which the way I explain, is responsible for all functioning, including emotional development. When there is a problem, which is, of course, is still being the details of which at the moment is not well understood, but there are research still going on. And I think the one that is already as a consensus agreement is that part of which could be genetic, part of which could be maybe because of the structure of the brain or because of the way the brain functions. So there's always a possibility that something goes wrong while a child is being developed. And as also we know that even other parts of the body can also be, not well developed, can be susceptible the same way that the brain development can be susceptible to developmental problem. And I think that's just simply the reason why people develop autism. They are born with autism. It's not something that it is acquired when a child is born. They are born with it. So it's not something that someone should be blamed, maybe a mother does something wrong, which is the reason, as in some quarters, some people believe maybe because of the parenting style and all that. So all these things have been proven not to be the case. So it's just the way the body developed in the pregnancy, organs are being put together, something went wrong along the line with regards to the brain, and those centers are not well developed. And then that's why, it develops into autism.
Okay, thank you so much. So it sounds to me like there is along the line of laying the blocks of things, our body, including the brain. Now we're talking about the brain. There is an abnormality or something has gone wrong. And then this child is born with this. So it's been in the child's body right from birth. Okay, so how do they present? How do we know that a child has autism? Because if it's something that is in the brain, we obviously we can't see the brain. So how do we know that this child has developed autism?
Yeah, unfortunately, because everything starts in the womb. But if there's anything, unfortunately, there's nothing, we can use to know if a child is going to develop autism while in the womb of their mother. So how do we know? Which is a very broad question, because when a child is born, at certain age, which is between the age of 0 and 1, this may not be too, it may be really difficult to pick it up, because at that point, you don't expect the child to start talking or to start making any form of interaction or whatever. But between the age of 1 and 2, that's when, especially a mother who is already experienced, who's had maybe one child in the past, and know the normal developmental milestone, what she expects between the age of 1 and 2. Say, for example, if a mother has had one child before the other one who's got of autism, she would see markedly a difference in their developmental, in the way they achieve their developmental milestone. One of which would be speech or communication, so in that sense, a mother may start to get concerns that a child is not making any word, is not saying anything, or is not calling for attention. And so it depends on the age. Presentations depend on the age of that child. Some children don't present until later in their toddler age. Some, in fact, some people reach a kind of adulthood before one will start to suspect that probably they must have had autism. So most of the time, the diagnosis is always kind of a retrospective. And I think some people, their presentations are usually maybe because of the complication out of the, from the autism, is what usually bring them to the attention of the services, especially mental health services, maybe because of the fact that they've been struggling to adapt to their environment, especially the schools or within different cycles. Some starting to kind of avoid school because they can't manage the school environment. So it depends on the age. So specifically, there is no any specific sign that people have to look for, but it depends on the age gap. Before presentations depend on the age.
Okay, thank you so much. So now, I'm sorry, I went off. I think my internet just went off for some time.
Yeah.
So
I thought I was talking to myself.
But it's okay. Yeah, we were not offline.
Yeah.
All right. So you were talking about the age. I knew you mentioned the age that when you just came back up. I mean, when I joined the discussion again now. So age-wise, is there a particular cutoff? I don't know how much you've said before. What's the cutoff? When do we start seeing, signs that's, because that's when we need to start looking very well. And what are the telltale signs that we can pick at that particular cutoff age, if there's one?
For a mother who is already experienced, who's already had a child, who achieved normal developmental milestone, from the age of 2, when a child is not babbling, when a child is not pointing fingers to object and is talking and is not pointing at object, when a child is finding it difficult to share toys with his peers, when a child doesn't share emotions with others, when a child sticks to just one particular toy and he doesn't want to let it go or share with others, that's what makes some mothers to start to worry as to whether this child is achieving normal development. And I think some mothers who are experienced, just like I said, would want to go to a doctor and say, look, my child is not talking, my child is not calling for help, my child is doing some kind of repetitive behavior, kind of things, or my child, depending on how experienced that mother is. But some mother, because of the fact that they haven't had a child before, it's always very difficult for them to know what they should be looking at. The one thing that is very important that one should bear in mind is that there are some deficits that are normal, that are part of the normal growth. That doesn't mean that they've got, autism. And that's why it's always very good to, when you suspect something that is outside of normality, to seek for an advice first. Go to a doctor who would signpost to a specialist who can maybe do some more screening question and answers. After that, then they can see whether they need to do a formal structured assessment. So that's in the lower age. And just like I said in the introductive part, some people don't even tend to pick this up until a child reaches adolescent age, or when there is a major transition, maybe from primary education to secondary education. And then, because these are the part of the things that they struggle to manage, that's when you start to see that the child is avoiding school. They don't want to go to school, but they can't explain the reason why, because of the fact that part of their problem is being able to express themselves. So most of the time, these children are being punished, unjustly, just because, they don't, people just assume that, well, is a tantrum, he just don't want to go to school and all that. But if deep down, if people are able to listen and do more investigation, one might be able to know. So it depends on the age group. So some other people in the adulthood who didn't have the benefit of being diagnosed or being picked up, you could see, because of their person, because of the way they behave, because of the way they interact with others, because of the way they talk about things, people would think maybe they've got a major mental health disorder, or maybe they've got a personality disorder. So it depends on what time that these things are picked. So it varies. And then another thing that I think I need to mention is this: autism is a spectrum disorder, which of course depends on varying degree of severity. Okay, what it means is, It depends on the, well, it has varying degrees of severity. The fact that some people are deficient in language ability doesn't mean they haven't got a well-developed social skills or social interaction skills, right? And that's why in autism, we've got people who are clear-cut autism, who've got clear-cut autism, and then we've got those who were diagnosed as having Asperger disorder. So lower down in the spectrum and then higher up in the spectrum. The lowest down in the spectrum are those who can't even express any form of language or any, so that's why it makes it really difficult as to what time that the sign can be picked up.
Right. Okay. Thank you so much. So I know you've talked about those telltale signs that we need to look out for. Now, how do we, if a mother or some relative that discover there's a concern with this child, it's not normal the way this child is behaving at 2 years, at 3 years, there is now huge concern. There's no social interaction. There's no good eye contact. They're not playing with toys. They don't want to share things, and where there are concerns. What will you advise the mother or the family to do as to getting a specific diagnosis, maybe on this spectrum that you talk about?
Yeah, just like I said, it takes time to make formal diagnosis because just like I said, is a retrospective assessment. And rigorous as it may be, because what takes some mothers to hospital or to wanting to seek advice in terms of child's developmental experience is when there is a functional problem. A child who goes to school, comes back, or trying to avoid school, or when he goes to school, he comes back, there's an outburst of anger, emotions, and then the next day or previous night, he becomes really, really anxious about this. Because apart from home, the other places where children interact with other people in terms of social interaction is at the school. And the fact that most of the time, other associated features with autism is sensory processing problem as well. Maybe because of the environment of the classroom, or maybe because of the nature of the fact that this autistic child has to interact with others, which of course they find really very difficult. There's always that problem when they come back home, and then people will not start to wonder what the problem is. And that's when sometimes it is even the teachers that pick it up and say, well, your child needs he needs an assessment, or he needs an advice from a professionals as to know what the problem is. Sometimes mothers don't pick it up. Sometimes it is the teacher that picks it up because the child is struggling to learn, and that's when the screening starts. And on average, it takes about maybe between 1 and 18 months before a proper diagnosis could be made. But some people would say, well, tell the mother to wait till maybe about 3 years, even if they've been able to pick up all these signs, and say, look, wait about 3 years. Let's know whether this thing is going to persist or pervasive before we can start to do some kind of assessment. But the advice is, any sign you pick up, don't wait. Maybe it's just some kind of support that the mother needs to help that child to achieve the deficient milestone that she's struggling with, not necessarily autism.
Right. Okay. Thank you so much for that. You talked about screening. I just picked the word screening in between. So what does the screening, what does it entail? How do we then screen? Because, these kids autism?
Well, the professionals who do the screening, there are screening tools which guide them, and I think they are well trained in doing this. It could be clinical psychologists, it could be a developmental pediatrician, it could be a speech and language therapist, or a psychiatrist. So this toolkits are well structured. It's just few questions that, some questions maybe like about 10 or 20 items that the mother will be asked. And it's relating to the observations that the mother could have, been followed up since the birth of that child. So we call it different. Well, one of the first one that I think is usually done is what we call developmental history, because they want to know if that child really, go along the expected developmental milestone expected by the age. So if there's any discrepancies based on what they are looking at and the level of achievement that they expect, which is the cutoff, if a child doesn't achieve that level, they may not want to signpost that, look, this child, we suspect that he might be having what looks like autism, needs further assessment. But if it is just the fact that just a little, few deficiencies are picked up, maybe it just needs some form of more support, either from the mother or either from a subspecialist. Maybe it's just a language delay, which of course can be dealt with by the speech and language therapist, but not necessarily fulfilling the diagnostic criteria for autism. So just like I said, the fact that someone has got traits of autism doesn't mean they fit that diagnostic criteria, being diagnosed as having autism. Because normally some development can be delayed, really.
Right, on a normal day. Yeah, I got it. All right.
Yeah, sure.
Not all the time that this happens, that we, even though we have the suspicion, it might still not be, autism.
Absolutely.
So it's a game of time that we have to wait and then assess these kids as they grow. And then we look at all those criteria that you talked about. Okay, thank you so much. So now we have about 10 minutes left on this program now. So we need to talk about, a child is being diagnosed now. They fit into a particular spectrum from our screening. Now, how do we manage this case, and what's the prognosis of this child, going into adulthood?
Very good question. So what makes the prognosis to be good is when it is picked up early in the child's life. There is no cure, to be honest, just to be clear, but there are treatments. And I think treatments are usually focused on the comorbid problems, because like I said from the introductory stage, that usually what brings a child to the attention of professionals is usually either complications arising from having autism. Some children can develop anxiety, major mental, difficult, because they're always anxious as to whether their interaction with others is going to be difficult. They are going to school, they don't know how they are going to manage that classroom because of their associated sensory problems, or the other mental health conditions like depression, OCD, because along the line, some of them got bullied because of their awkwardness, because, these are the things that are associated with it. And then there's ADHD. And then from the repetitive behavior like tapping, rocking, sometimes this does result to self-injurious behavior as well. Some of them develop some kind of maladaptive behavior. They just want to kind of try to manage, to navigate the way they manage their environment. Some can become aggressive. Some become, wanting to avoid school. So in a way, general functioning and challenging behavior, those are the things that are associated. So one would want to start to identify those other problems and try to treat them as effectively as possible. And then another thing that is very important is that not all autistic children are disabled, okay? And just like I told you, it depends on the level of the spectrum. Some are actually high achievers because when they pick interest in certain things like maybe mathematics or numbers or astrology and all that, they tend to perform better than anyone else in it. So it's a way of trying to identify what they are the best at and then build that strength up with them, and then they can excel. So it's just treatment is about maximizing functioning and help them to achieve their maximum potential.
Right. Thank you so much. So are there medicines?
Yes.
You don't need to say just yes or no. There are.
Treatment is just is divided mainly into two groups, which is behavioral modifications. If there are things that they are doing that is of challenging to everyone or to themselves as well, there are ways that professionals can advise mothers to modify their behavior, the way they respond, especially when the young ones. Try to reward good behavior, and then those ones that are not good, try as much as possible to ignore them. So in terms of medication, depending on because of the behavior, there are certain neuroleptic medication, antipsychotic medication that helps with aggression, helps with repetitive behavior, self-injurious behavior. It tends to lessen all those ones. And then anti-anxiety medications as well to help them to manage their anxiety. And then there are also psychological treatment as well, like CBT and all that, talk therapies, which help them to manage their anxiety and OCD as well.
Right. So in a situation where obviously we have cases where, especially in Africa, a child is in a spectrum. They've not been diagnosed. They have a particular spectrum. But what we see is, oh, this child is very stubborn. And then, we'll smack them. We do all sort of things and maltreat these kids until the situation gets worse. And then later on, it's all they're criminals. What advice do you want to give, the society on issues like this?
I think I think I'm happy you mentioned this, Femi. It's not only about punishing them. I think because of some beliefs, because I've seen cases with some people from African background who actually believe, especially with those children in the lower end of the spectrum, because of the repetitive behavior, odd behavior. Some even believe that they are possessed. To be honest with you, as far as that goes, I've seen some that would think that maybe prayers only will help them. And I've seen cases where children have been taken away from their parents because these children are really very susceptible to being abused, just like you said, because the parents have no primary knowledge as to what the problem is. The only thing they could see was those challenging behaviors. So what I think all parents should know is that this is a developmental problem. It is not a fault from anyone. It's just like every other developmental brain, that has to do with the brain that led to a child not having proper emotional development, communication development, social interaction development. And I think their behavior is observed to be, to some extent, completely different from the way other people behave. And I think the simple thing is to try to identify this and try as much as possible to help this child. Parent needs further support, go to a professional, go to pediatrician, go to a psychologist, go to family doctor, and then they can advise them on what to do. And then if there is need to pray more on it as well, there's always room to pray, to add to the, but what is most important is professional consultation.
Thank you so much, Dr. Omokanye. Now, I think we're getting to the end of this. We still have so many questions. There are so many things to talk about, autism. We have not even talked about the prevention. We've not talked about, the co-management of certain, situation. I think it's a huge topic to talk about for the short time that we have. But I don't think we'll be able to take more than this today. We will be looking forward to possibly, having a part 2 of this discussion, maybe in the nearest future. If there are needs, because it's important, for people who need help in 1 minute, how do you think they can access this help, especially in developing countries?
Developing countries, and I think you've mentioned it. If you know your child is not developing, is not along the normal track of development, either you suspect something is delayed in terms of speech, in terms of interaction, in terms of emotions, don't try to blame yourself or try to blame the child. What the child needs is support. Now, support, doctors in various health institutions in developing countries have idea about autism. If it is something that they can't provide help or advice directly, I think the easiest thing I think some of them can do is to signpost or to try to, suggest various organizations that are interested in this. And I think there are some that are there, but it's just that they are not well publicized. And I think maybe people don't really know that they exist. So don't try to keep this to yourself. It is quite common. There are almost like about 2% of people, or one in 100 people have it. You can see how prevalent that is. So it is very common, and it is something that help is available for people to get information from.
Yeah, so it's more of awareness. You have suspicion, go and see your doctor. And I think you mentioned, the pediatrician, developmental pediatrician. They're also there to also support, institutions like this. Thank you so much for, coming to share today again, Dr. Omokanye. We look forward to actually having the part 2 of this, because there's still quite a lot of things that we need to talk about autism. Maybe we'll focus more on how can we manage, what are the things that we can find locally, what structure can we put together locally, especially in developing countries, tapping to your experience, abroad. What can we set up locally to support, this group of people who might be suffering from the situation needlessly due to the fact that we do not have the right awareness created. So thank you. And to the viewers at home, if you have questions, you want things that you think we can help with, don't forget you can leave your message here at the message portion of the Facebook. We'll be answering them, and we will contact you if it's needed. Thank you so much, and have the best of the weekend.
Thank you for having me. Thanks so much.
Thank you so much. Bye-bye.